Hi, I'm Professor Debbie Trotta, and I would like to welcome you to the University of Cincinnati Blue Ash College Nursing Program. I'm the Simulation Coordinator, and will give you a brief overview and orientation of the Simulation Lab. The Simulation Lab is a learning environment where our goal is to help you bridge nursing theory with clinical practice. The Simulation Lab is located in Walters 276. It is designed to provide realistic patient situations in a safe learning environment. The use of simulation in nursing education is designed to promote critical thinking, assist with clinical decision-making skills, and encourage effective communication and teamwork. We have several mid-fidelity simulators representing different ages, genders, and medical conditions. Our simulators are able to produce sounds such as coughing, moaning, and screaming. Students can also hear heart, lung, and bowel sounds and are able to assess blood pressure and pulses. Each semester, you will have 1 to 3 simulations related to your course curriculum. Simulations are performed in small groups ranging from 2 to 5 students. Scheduling for simulation varies from course to course. Faculty may schedule you, or you may self-schedule using Starfish. Your course faculty will provide you with specific scheduling information. All simulations have prep work that will help you get ready for the experience. The prep work is available on your course Blackboard site under the Simulations tab. On the day of your simulation, you will need to arrive at the waiting area outside the lab in your clinical uniform prior to your start time. A faculty member will bring your group into the lab at your scheduled time. When you arrive, you will need to place your belongings in the entryway. No food or drink is allowed in the lab. Water bottles can be stored on the countertop. You will need to keep your pen, stethoscope, and prep work with you for the simulation experience. You will begin your simulation experience with a review of the patient scenario and brief orientation to the lab. At this time, you will also be assigned a role, which may include primary RN, secondary RN, family member, observer, etc. Students need to use appropriate professional bedside behaviors. Treat the simulation as if you were with a live patient in a real clinical setting. This includes evidence-based practice, attention to infection control, safety, and communication. The primary nurse will receive a bedside report. Then the primary nurse will assess and perform care based on findings. The primary nurse can delegate to others within the scope of practice. Faculty will be behind the observation wall and provide the voice of the patient, physicians, and other roles. Students in the observer role have the important job of documenting their observations and will share those observations during debriefing.
Blood pressure was 114/60. 114/60 for the blood pressure. Respiratory rate of 22.
The simulation ends when the students meet the learning outcomes or when the scenario progresses to the point where the faculty determines the outcomes cannot be met. After the simulation is complete, students and faculty go to the debriefing room to review the experience. This is a time for students to reflect on how they felt in each role and share what they think went well as opportunities for improvement. As the simulation experience is wrapped up, it is important to remember that what happens in simulation stays in simulation. In order for the experience to be new and exciting for future students, we need to keep the scenarios confidential. In addition, we want simulation to be a safe learning experience for all students. Students report that simulation is a teaching strategy that helps them gain confidence and competence.
My thoughts about simulation prior to going through simulation were I was really nervous kind of about the unknown. about if I was going to make a mistake, if I was going to be judged.
But that's not what you want to take away from this scenario or situation. The goal of simulation is to help you think on your feet, critically think.
But after going through simulation and seeing how it works, it's a lot calmer. I feel relaxed more. It's nice knowing that I have someone behind a screen that I can ask a question to, even if I don't know the answer, or if I get nervous, or if I just need to stop for a second.
Scenarios like this will help me in my field get prepared.
This is all supposed to be like a learning experience, and we debrief about it, so we go over what we did good.
Some people come and ask, oh, what did you do? You know, how did you calculate the medication? You know, how many milliliters is that? You are not really supposed to tell them because it's their experience. So, and what your experience might have been, it might be different for them. Also, you know, with every role, it's different. Observer is a little less pressure. Primary nurse, the greatest pressure.
These scenarios are posted beforehand, so if they go through the scenarios and get the information from the scenarios and try to go through their textbook or get any information they can about whatever is listed, whatever problems, medications, they can look them up, you can find the side effects. It makes it a lot easier because when you come to simulation, you're already nervous. And if you don't have that information, then you're not going to be able to perform as well as you want to. But if you have that already looked up, then you kind of a little bit know what you need to expect, and you're more at ease and you tend to do better.
I like being able to act out a scenario. It helps me apply it to the real world. I like simulation.